Yeah.
with the rest of us.
It would be nice to take the kids out in the snow with the sleds, but it's too cold to go out and enjoy the snow. The grandkids. So we just stay inside.
And I just want to mention to everyone, we are live, so on the air.
So no shady business?
Yeah, no shady business, yeah. Everyone's trying to get in there.
Hey.
Mike, to start with, do we have any citizen comments to address?
There are none. I did check right before the meeting, and there's nothing to report, Dr. Warner.
Okay. And Mike, we are now live. We're recording.
We are live. We are live. Yes, sir.
All right. Well, it's 7 o'clock. We can go ahead with calling the meeting to order, and I have to read a statement like I do at every meeting. Until further notice, meetings of the Board of Health will be held electronically, with the majority of members participating via remote access in order to comply with the State of Illinois gubernatorial disaster proclamation. Members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Michael Charlie with the Skokie Health Department, and all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may also be submitted by email to citizencomments@skokie.org, by email to the Village of Skokie, attention, Covet, Director of Health and Human Services, 5127 Oakton Street, Skokie, Illinois, 60077, or via the Village's Dropbox located by the public entrance to Village Hall. With that, I want to welcome everybody tonight. I think with our weather, this is one time when it makes sense to have virtual meetings rather than having to trudge out in the cold and the snow. So welcome. Mike, did you want to take attendance then, so we have an accurate depiction?
Sure. So, and I apologize. I'm still getting to know all your faces. But I think I'll go over the entire list. And if you're here, just wave at me or yell out your name. So I have Trustee Bromberg. I didn't see her. Dr. Dave. Dr. Drashler. I saw you, Mickey. Dr. Gaines. Dr. Hato, or Juliet Hato, sorry. I did see her, didn't I?
I'm here.
She's here.
I'm here.
I saw you come in. Hold on, I got someone in the waiting room. I gotta let him in. Okay. Where was I here? Maureen Hanlon?
Here.
Margaret Keeler, I saw you. Gurja, I know him, Gurja Kumar. Okay. Dr. Lynn, I saw him. Ashley Moy Wooten. Heidi, you guys have some of the toughest names I've ever read, so I apologize, but Heidi Nikish Dugan. Did I get that right? I'm sorry. Rohit Pandya.
Yes, sir.
Okay, I got you. I see you changed your name. It was a number before.
I know.
You did good.
Last time, everybody tried to help me and I was able to. So today I knew exactly where to go and change my number to.
Oh, that's good.
Okay,
That's
great
good.
job. Okay, Kayungran Shim. Dr. Sood.
Yes, sir.
Okay, I saw you. Okay, Patricia Urbanis. Okay, Urtaza Uzman. Okay, almost finished. I saw Ruth Varma is here. Michael Vernon, I saw you. Dr. Warner, I saw you. Dr. Williams. And then the last but not least is Sybil Yao. Okay, I think I got everyone. Thanks.
All right. Is there anyone new tonight? Margaret, have you been at a previous meeting?
This is my first meeting.
Well, you want to tell us a little about yourself so we get acquainted?
Sure. I live in Skokie. My husband and I just moved to the 60203 area code a few months ago. I am a PA and I work at a clinic in the city on Elston and Pulaski. I actually used to work with Dr. Vernon at Cook County, but that was a very long time ago. And then I was at the Evanston Health Department after that, and then I went back to school, and now I'm a PA.
Yeah. Well, welcome.
Thanks.
Margaret, it's so good to see you.
So
This
good
is
to
Mark.
see you, Doctor.
All right, well, you've received the agenda for tonight and also 2 sets of minutes. We delayed approving the minutes from December because you really didn't have a chance to look at them, and the minutes from January. And we've been using a consensus approach to the agenda and to the minutes. So unless there's some item to extract, consider the agenda and the minutes approved. And there is just one thing I think on the December minutes that Mike has taken care of, and I think that was Dr. Kumar being listed as one of the attendees, so that's been taken care of.
Mm-hmm.
So anything else to extract for discussion?
And I did update Dr. Dave to Dr. Instead of Miss. So I'll correct that on both December and January's meeting minutes.
Great, thank you. Well, with that, we'll move into the agenda, and the first thing is a COVID-19 update from Mike Charlie, our fearless director.
Yeah. So I apologize, this month, I don't know, I got some more people wanting to come in, I'm sorry, I'm not paying attention. Ganson Kumar, okay. I gotta keep track of who's here, Kumar, okay. So yeah, I don't have a PowerPoint presentation for y'all tonight, but I do have some updates. So first of all, updates on our COVID vaccination campaign. We've administered 6,199 doses of vaccine. An overwhelming majority of those have been first doses. I think that we've administered around 500 to 600 second doses, but for the most part, we've been administering first doses. The next next several weeks, we're going to be seeing about anywhere from 1,300 to about 1,700 second doses per week. So it kind of paints a picture that, you know, we pushed out a lot of first doses the first couple weeks, or at least over the last couple weeks, and now we're going to have to start with a lot of the second doses. We've had 11 vaccine clinics through February 11th through today. You know, clinics held include first and second dose clinics. Clinic participants have included Skokie residents, Skokie group home residents and staff, Skokie school educators, Skokie licensed daycare staff, village staff, and volunteers that are working at our vaccine clinics. We've also shared 3,750 of Skokie's Pfizer doses with the North Shore University Health System, where they are using it to administer vaccine to their healthcare professionals. The second item on my list is I wanted to mention that Governor Pritzker announced that an expansion of Phase 1B, effective February 25th, to those people that have comorbidities or underlying health conditions as defined by the CDC, you know, things like heart disease, cancer, and other things. This is something that's new because originally that group of individuals was identified as being part of Phase 1C. So we've had some internal discussions with the village manager's office about, you know, how we're going to accommodate this, because we have already thousands of 1A and 1B identified individuals, previously identified individuals that are waiting for a vaccine. So we're still working out the logistics on that, but certainly adding that whole additional population, these are people under the age of 65 with underlying health conditions and disabilities. And we'll have to see how we can accommodate that group as well as the thousands of other individuals that are already signed up on our pre-registration list. Speaking of our pre-registration list, as of yesterday, we had 25,000 people that had pre-registered.
Oh, my God.
So it doesn't mean that there's 25,000 people waiting still. We have been working through the list. What we've been doing is we've been giving priority to those in 1A and 1B and offering them an opportunity. And those people who registered first, we're reaching out to them. And like I said, we've administered over 6,000 doses so far. I mean, that's over 10% of our population. And of course, that doesn't include all of the doses administered through the federal Walgreens program where they're administering doses to our long-term care facilities. And we really don't know how many, well, I guess we could check eye care, I suppose, but I don't really have the statistics on other residents that are getting vaccine through other healthcare providers, pharmacies, things like that. So, but I think, I will say that, I got someone else waiting. I did want to mention that, let me just write I got to keep track of attendance. I did want to mention that we are not stockpiling vaccine. To be honest with you, with the allotments that the state's giving us, it's getting really hard for us to even administer first doses moving forward over the next couple of weeks. We're just so short, and we pushed so hard in the beginning that we may just have enough just to vaccinate second doses. So maybe we were too good, maybe too efficient with getting out the vaccine. We were pushing out several thousand a week. But right now, at least for the next couple of weeks, the doses aren't going to be as available. And they project that vaccine will become more readily available in March. So we're certainly hoping that's the case because we're set up to vaccinate a lot of people, and we can't do it without the vaccine. I did want to talk a little bit about the COVID-19 mass vaccination grant that we applied for today. The state has offered us $200,000 in additional grant monies to support our COVID-19 mass vaccination program. Certainly not, it's not going to cover all of our expenditures for this, for the clinics we're running, but it certainly helps. Most of the money is budgeted to go for personnel costs and salary. We do have some operational costs involved with running the clinic too, but most of it's salary and personnel costs. Some other data for COVID-19. Again, our webpage has a ton of information on it regarding like local statistics, but we have about 5,270 residents that have tested positive, 109 deaths, and our 7-day moving average in regards to the number of cases per day has gone down since November. We certainly have seen a downward trend like the rest of the state, which is really good news. And hopefully we continue to see that trend because like the rest of you, I want life to go back to normal. In regards to our positivity rate here, our 7-day moving average is about, it is 3.82%. Just to give you a form of reference, so we're about 3.82. Cook County is about 4.8 as of February 8th, so we're a little less than the county. Maybe to be expected just because of the income level and the demographics here compared to certain areas like Cicero and other areas that have higher positivity rates. But it has gone down also. our positivity rates sort of parallel our cases per day and the rates we're seeing throughout the state. In regards to Restore Illinois update, Restore Illinois is the plan, certainly to get businesses back up and running, and it's the plan that gauges sort of where we are with businesses, and we are currently in what's called phase 4, where there's a continued decline in the rate of infection. Hospitals have capacity and they have surge capacity at this time, and it allows restaurants to open up at 25% capacity or up to 50 people, whatever is less. And there's all sorts of changes in regards to businesses, and as you move through the phases, the state becomes more lenient and allows businesses to reopen a little more, which is really good news because we know the businesses are struggling. Outside of that, those are my COVID-19 updates for tonight, and I can certainly answer any questions if the Board of Health has any.
I have a question, Mike. You said there are 25,000 people pre-registered to get COVID vaccine in 1B. How many of those people have been vaccinated?
So there are 25,000 people total, not only in 1B. So it's 1A, 1B, and would be 1C and 2. And then whatever is beyond that. I know we've vaccinated 6,199 individuals. I don't have an exact number for you, Maureen, in regards to how many people came off that registration list, but an overwhelming majority of those individuals are residents. I would say 5,800 of them are residents. So I don't know how many of those 25,000 on that list have actually received the vaccine. We have the data, I just don't have it with me. Good. Dr. Lynn?
Yeah.
Yes, I don't have a question. I just have a comment that I want to direct to my colleagues on the board. I had the privilege of volunteering at many of these clinics. And I want to congratulate Mike and his professional staff, and I put professional in capital blocks because the compassion and the way that they have dealt with many very challenging people, because many have had some significant issues, and the organization is commendable. And I just think that you should all know what a great job is being done. And if we had more vaccine, more people would benefit by it. It's not Stokey's program that's a limiting step, just the availability of the vaccine.
And I also want to thank Dr. Lynn and all of our volunteers. I don't know who else may be listening to this, but without our student volunteers and without our Medical Reserve Corps volunteers, our pharmacists, there's no way we could do what we're doing. We wouldn't have enough staff in the village to staff it and do everything else we do. So, a big round of applause to those people too. Dr. Lynn was even, I think it was earlier this week, he was actually in sorting and putting together syringes and needles and putting everything together, because for every hour we spend at the clinic, we spend another hour preparing for those clinics. So again, without those volunteers, there's no way we could be doing what we're doing. So kudos to them too.
Yeah, and I just want to echo what Dr. Lynn was saying. I had a chance to observe a couple of the clinics, and they're very well run, very efficient, and the compassion that's shown, I think, is extraordinary. So again, congratulations to you and your staff.
And I just want to say that I received my vaccine from one of these clinics, and I agree with the comments from the two previous speakers that the clinic is very well organized, and there's a nice, even flow to people coming in, waiting in that observation area, which I think is very well laid out and organized, and then leaving from a separate entrance. So that's good. I have a question for you, Mike, regarding the vaccination program as it pertains to teachers. Can you comment on how you're doing in that regard with teachers and school personnel?
Yeah, so we had originally, sort of towards the beginning of our vaccination campaign, prior to moving to the state's EM track software, identified the fact that we were more prepared for like a closed, like teacher-only point of dispensing operation than opening it up to the public. Really, the teachers were sort of our guinea pigs, to be honest with you. And I don't mean to say it in a bad way, but we sort of had a captive audience of teachers and educators. So we had vaccinated, I would say, approximately 1,000 plus of our educators in Skokie from our Skokie schools. And then we actually were going to try to get them back in this week, but we just don't have enough vaccine. So we intend, we also have had allowed our Skokie daycare center employees to come in and get vaccinated, and our group homes to come in and get vaccinated. While also we're trying to balance it out, I think, most of the vaccine since we did the teachers back on the 19th and 20th of January, all the other clinics have really been opened up to residents to give them an opportunity to come in and get vaccinated. And we've tried to use this, a fair, equitable approach to that. While I think internally we certainly understand that teachers are very important and we need to try to get them back in as soon as possible, again, it's just the vaccine shortage situation that's really hurting us at this point.
And one last question, Mike, do you have any homeless shelters in Skokie?
I don't think we do have any. I think there's one in Evanston. I know we work with Connections for the Homeless.
Yes.
But I don't think that, I haven't at least had any conversations with them regarding the homeless, and that's something maybe the city of Evanston is dealing with. At least correct me if I'm wrong, I think that that's the case, or the Connections from the Homeless isn't, maybe it's not located in Oak Park, but no, we haven't.
The only reason I ask is that I just wrote guidance for this population, which was released this week, and I was going to forward copies your way.
Yeah, I'd still be interested in it.
Okay.
I think the information we share is very important, but I think we need to recognize that we are a very privileged group based on our understanding of this disease and understanding of administering vaccinations, as opposed to the approximately 20,000 people who are pre-registered and waiting to be notified that they can have an appointment and are anxious because they're not vaccinated. That perhaps on the webpage with the COVID information, we can make a better explanation as to understand, yes, they know they're registered, they have no information about where they are on the line or when they're going to get vaccinated, and that is solely because of the lack of supply of vaccine, that needs to be communicated in a more clear way so they have an understanding of how hard the village and the health department is working to get them vaccinated. And this is based on my own experience and those of my neighbors who have come to me and asked me, why is it taking so long for us to get vaccinated when we have this great health department?
Good point,
Yeah.
Would you mind if I added something to that, just kind of anecdotally? I think from my experience at my clinic, and we've been doing many vaccines every day, people are calling and they're hearing on the news that there's going to be this uptick in vaccine availability. And so I think there's a small disconnect between what they're hearing on the news and the reality of how much vaccine we actually have. So I agree. I think some kind of very basic education on the fact that we're truly not, we only have a very limited supply would be probably a really good idea.
And the fairness and the way it's being administered too is important for people to know.
Something that we may want to think about, and that is having a town hall virtually where people could ask questions. We could have members from the Board of Health, from the Health Department, perhaps some of the trustees, so that we can get this information out to folks that are worried, quite frankly. You know.
Yeah.
Mike, when more vaccine becomes available, is it the plan to add another day or lengthen the 3 sessions that you have?
I think it's a combination of both. Currently, we've been vaccinating Tuesday, Wednesday, Thursdays. I think really the primary reason is just staffing. We have Oakton Community College nursing students available to us, but we've discussed expanding to Fridays, possibly Mondays also. I mean, and expanding the hours. Currently, we've operated from anywhere from like 9:30 to 2:30 or 10 to 3, and we could expand those hours also. So just think about it this way: in a 5-hour period, that clinic can administer right around 1,000 doses right now. That's kind of pushing our limits. We have been increasing our throughput. So like this week, instead of having 30 people every 10 minutes walk through, we had 33, and we're trying to test it till we hit our breaking point. We certainly don't want people waiting outside for too long in the cold. So so that's been, you think about it, about 200 people an hour that we can vaccinate there.
Yeah, and then Nikki?
Yeah, I mean, not to overly emphasize this point, but I've been registered to be in 2 clinics that were canceled. And these were Tuesday clinics, and because there was no vaccine delivered. This happened twice. The state did not deliver the vaccine. And the clinic that I staffed yesterday, we finished early because there was no more vaccine available. Because they're trying to budget it because today was going to be a second dose clinic. And as you know, once people have been receiving their vaccine, you have a window that you have to deliver the second dose. It is very challenging. And I would say that's the first thing that has to be corrected is the availability of vaccine. And I agree with what Margaret said, and I want to emphasize her point. There's a lot of politicking going on and a lot of promises being made. They're not being fulfilled for a variety of complex reasons that I don't, assume that I have the answer. And I think that when in another part of my life is I'm involved working to try to educate trusted messengers to deal with vaccine hesitancy. And I'm sure there's vaccine hesitancy in our community, but what I've experienced is vaccine urgency. And I get called and emailed on a daily basis. Individuals are running all over the metropolitan area that I know of from Skokie and getting their vaccines at Walgreens or other institutions, and they may be double registered. So as Mike was pointing out, they have to go through that list and be able to identify those people that are still available and want to have their vaccine given. There's a lot of background work. And as we expand clinics, there's going to be a need to figure out how to prepare for those clinics. In terms of getting the syringes not loaded, just in an operational way of dealing with it. Because we get supplies of syringes and supplies of needles, and they have to be put together, and and make it available for the draw team to be putting in the appropriate aliquot in each syringe.
Nikki, you had a question?
No, I have a comment. Having been on the list a long time ago, but having dealt with many family members who didn't qualify immediately as a healthcare provider, the question was, if I'm on a list, how do they know that I'm on the list? Do I need to call in and find out? Do I need to get on another list? In other words, you have a list of 25,000 people that can be calling in every day to say, am I still on the list? Is there some way to send out a message almost individually to confirm that they are on the list, because you start thinking maybe they forgot me, maybe I got lost on the list? but is there some way of confirming to those people who are waiting, even though they're going to Walgreens, even though they're going to CVS, but just to let them know that, yeah, we know about you, we got you. It's like being on a telephone call and being put on hold, and you're wondering, did they lose my call? But in other words, to reassure these people that it is because of the lack of the vaccine that you're not getting vaccinated. It's not because we have ignored you or intermittently reassuring them that, yeah, we got you, we'll get you as soon as possible. That's the thought.
Yeah, and there's the only way at this point that somebody would know if they're still on, well, first of all, the way that it works is that anybody who submits, fills out the survey or registers, it goes on a master list. They invite based upon priority and where you registered. If you do get your vaccine or set up an appointment, then they'll remove that person from the list. So you do move up. In regards to exactly where you are on the list, I don't think that the way it was set up, I don't think there's a way that for us to like automatically send somebody like you are like 9,500 out of this. But I'm just being honest, the only way that somebody I think would be able to get that information is if they called the COVID-19 hotline and asked, and I think that somebody could tell them. I'm not saying it's a good system. I know that the village manager's office is aware of your concern, Dr. Dreckler.
Well, my purpose wasn't to tell them you're 25th or 2,000 on the list, but just a reassurance every once in a while that, yes, you're on the list and we haven't forgotten about you.
Yeah.
That's all. I wasn't so much saying, getting everybody to know where they are. But every once in a while you like to know that, yeah, I'm on the list.
Sure, I understand that.
Rohit?
Yes. So I registered last Wednesday through the village website for the COVID vaccination, and I'm being a health professional, 65 plus. And after I registered, I thought I would get a confirmation from that website that yes, my registration has been in place. So a few days I didn't receive the email, so I called, and I was told to call, like Mr. Charlie said, COVID hotline. I left the message, someone called me back from there. He said, no, you would not be getting any confirmation. You would be informed when your turn comes. Like Dr. Dreckler said, it would be good to update that website so at least whoever registers, they know that they've been registered. And, then you can wait. You can wait 2 weeks, 3 weeks. Do you see my point?
Mm-hmm. Sure. And all of this I'll communicate to the village manager's office, just some of your recommendations and feedback.
I kind of have to agree with Mr. Rohit in terms of updating the website rather than Dr. Dreckler, I think it's a great idea if we could reach out to people individually, but I think that logistically that would probably be a nightmare. And to be quite honest, a lot of people who have registered for the vaccine in Skokie are also calling around, their own doctor's offices and clinics everywhere else. I myself have vaccinated many people from Skokie and Evanston and the North Shore. So those people who probably have already registered maybe have already gotten their vaccine and don't even need to be on the list. So maybe just a website update on that kind of thing would probably maybe be very reassuring for people rather than reaching out to them individually.
And we have a comment from Dr. Kumar in the chat box in terms of being able to volunteer for one of these clinics or for several clinics. So Mike, what would the process be for that?
Yeah, so if the chance to volunteer or just visit?
I wanted to
board. I want to, I would like to first come and see, and yes, I'm more than happy to volunteer. If you give me a day, I can take off from work and be there.
Yeah, so in regards to like visiting the site and having like a tour of the site, I'd be more than happy if, some Board of Health members were interested in getting a tour. I'd be more than happy to set that up for the Board of Health members. In regards to assisting us, so if you're on the Medical Reserve Corps already, which is our volunteer medical group, then, you can certainly volunteer whenever we have positions open that need volunteering. If you're not currently on the Medical Reserve Corps, please go to the Medical Reserve Corps webpage. It's the Skokie Medical Reserve Corps. And on that webpage, you can review the information. And even if you're not a medical professional, you could apply, although we're primarily looking for pharmacists, nurses, physicians, licensed professionals, medical professionals. And what would happen is you'd apply. There is some back-end work we have to do with reviewing your application and getting background checks. And then what we would do is we'd fit you within the queue of the volunteer queue. And when we do, especially when we expand the clinic, we're certainly going to need additional volunteers and try to provide you opportunities to volunteer and help out.
Mickey, you had your hand up?
No, I wasn't talking about more individual, but if you have a list and can send out a message or even put it on a website that, yes, we know that you're still on the list, you don't have to individualize your person, just something that says, yeah, we know about you, and you're one of many that we know, but you're still on our list. So that was more I was working at as opposed to individualizing each person.
I think that sounds like a great idea. So.
All right, are we ready to move on to the chair's report? Any more discussion? All right. You may not be able to see this, but this month's journal from the American Public Health Association has a special section on electronic nicotine dispensing systems, recreational or prescription drug. And it has a number of articles looking at are the electronic nicotine dispensing systems effective for smoking cessation? And the answer is kind of mixed there. But there was one thing in the article that jumped out at me, and that was a report from Louisiana that although tobacco use among high school kids had been going down, there was a 45% spike recently in kids using the vaping, the electronic dispensing systems. And it was attributed to the marketing that the companies are doing to teenagers, especially around the flavored vaping material. So that's something I know a little bit further on the agenda, but it certainly is a pertinent topic that I think we need to look at as the Board of Health. The second item that I had is the equitable distribution of the COVID vaccine is a huge issue, and I've been in some discussions on that around things like communities of color, minority communities, also some folks that may not have the technical skills to be able to go on site and register and get very frustrated. Sometimes they have their kids help them out, but I've heard that technical divide, digital divide is an issue. And then finally, what are we doing about homebound people that really cannot get out? So those three things, minority communities, the folks that have technical issues, and then the homebound people. How are those things being addressed in terms of the vaccine rollout?
Yeah, in regards to the homebound individuals, if any homebound individuals, have concerns about not being able to make it to our clinic for whatever reason, I'd suggest they call the COVID-19 hotline and or the health department directly, and we can see how we can help them out. We don't have any plans on going out to people's individual homes at this point. But, if we can find a way, if it's possible to get those people, even if they have mobility issues, to the clinic, we'll try to get them there. In regards to the equity issues and the issues of, those who are elderly or unable to register via the website, again, we've been helping people pre-register if they call us, and or we've been encouraging those individuals to use their loved ones or family members or neighbors to help them. In regards to actually scheduling an appointment at our clinic, we have been, anyone who doesn't have an email address, we've actually been contacting them via telephone and walking them through the process. I mean, we basically set the appointment for them. In regards to some of the different, groups of people that maybe aren't as privileged, outside of communicating to people through the postcard that went to every address and our webpage and our Skokie e-news. We have been doing a little bit of, we are meeting with people at the ELL Center, and we did set up a webinar for people who are Assyrian and some other ethnic groups that maybe like refugees, and we are trying to help them out by meeting with them. But outside of that, Dr. Warner, we really haven't done much in regards to trying like outreach through churches or other things like that at this point.
And the federally qualified health centers in Skokie that may deal with particular groups of folks, are they part of the Skokie program, or are they doing it independently?
Well, we've actually given some vaccine to several of them, and so they're aware of our vaccine program, and we do keep in touch with them. So I'm certain that they're aware that we're vaccinating people at our facility.
Thanks. Dr. Kumar.
So the people who are in the nursing homes, are they part of Skokie program or the Walgreens doing in their nursing homes?
Yeah, so every one of our nursing homes and long-term care facilities, assisted living facilities, they're all signed up with the Walgreens program.
All right, well, we've given you a lot of suggestions, Mike.
No, they're all good suggestions too, and I appreciate it. It's great feedback.
In terms of the director's monthly report,
I have a couple small things, to be honest, we're a lot of COVID right now. So, I just want to mention a couple really cool things that the Human Services Division, which, as you all know, it was incorporated into the Health Department late last year. They have a tax program for seniors that they do every year. It's a really great program where it's an AARP tax program. There are people who are trained, and over the years they've met with seniors free of charge to assist them with their income tax preparation and submittal. And this year we're partnering with the Skokie Public Library, and we have the good news is with this program is we have 80 seniors registered to use the program. The bad news is that we can only accommodate 80 seniors at this point. So we've sort of maxed out already. So that program is expected to start right around March 1st to make sure we get people's income taxes prepared. Also, through Connections for the Homeless, we've been able to help 16 Skokie residents with financial assistance for their mortgage and rent and utilities. It's a really cool program where people who lost their jobs or are just down on their luck can submit an application through Human Services to get assistance with utilities, rent, or their mortgage. And like I said, we've helped 16 families out, so that's a really great program. Outside of that is business as usual in the health department, and so that's about it. Thanks.
okay, thank you. We've got a couple of items of new business, old business, and one has to do with the fact that when viruses circulate, they mutate. And when they mutate, there may be significant mutations that cause what are called variants that can change the characteristics of the virus. And we're hearing about that now with the UK, the South African, and the Brazilian, I think, are the three. And I just saw today that in Illinois, the South African has now been identified. So I've asked Dr. Vernon to give us an update on what's happening on the Illinois side and what's going on with genomics sequencing, and what are the plans going forward when these variants start surfacing in the community. So Mike, thank you.
Okay, thanks for the invitation to speak about this, Dr. Werner. Is it possible for me to share my screen? I've just got 5 slides that I thought I'd use.
You should be able to.
There's a little box at the bottom of the screen that says share screen.
Can you see my screen now?
Yes.
Yeah, we can.
Oh, perfect. Let me see if I can put it in slideshow, and then that should make it even better.
Perfect.
Today, can you see that? Okay, great.
Yeah.
Okay, so what I'm showing you here is a schematic representation of the SARS Covivirus genome. It's that long bar with the colored sections on it. So the genes that contain the instructions to build parts of the virus are in these various colors, as you can see here. And the part that I want you to focus on is the brown section in this picture, which has the genetic instructions for building the spike protein, which are those spikes that you see on the external circle of the virus. You see it in every picture whenever people talk about the SARS-CoV virus, you see that. And this is the spike protein allows the virus to attach to human cells during infection. So this is the section of the genome that serves as the key region for monitoring mutations. There are 3 variants that are of concern to us, as Dr. Werner said. The first is the B117, and this is the variant from the United Kingdom, which was recognized late last year, and it was first detected in the US in December. This is associated with an increase in deaths compared with the other variants. However, more studies are needed to fully understand this and verify that this is true. And then the second is the B1351 variant, which is, in other words, referred to as the South African variant, because this is where it was first identified. So this emerged independently, and then it was first detected in the US in January of this year. Some preliminary evidence suggests that the Madonna vaccine, which is the one that I received, and I believe most of you have as well, that this variant may have some effect in the efficacy in terms of protection from this vaccine. But here again, we need additional studies to determine if this is in fact factual. And then the third is the P1 variant, which is the Brazilian strain. This was identified in January of this year, and also first detected here in the US at that time. There is evidence to suggest that some of the mutations in the P1 variant may affect the ability of the antibodies from natural infection or vaccination to recognize and neutralize this virus. So there is, of the 3, this is the one that causes greatest concern. So just a few notes or facts about these mutant strains. 35 to 45%, they are 35 to 45% more transmissible than the original or wild type strain that is in circulation in the community. Cases are doubling every 7 to 10 days, which is an alarmingly high rate. They're more effective at binding to the receptor sites in the mucous membranes, and this is why they are all deemed to be so much more transmissible, because of this binding factor that they have. They can be detected in genomic sequencing of the SARS-CoV virus isolates, And this is how we were able to identify these strains. If we do not perform genetic sequencing, we would not be able to differentiate these mutant strains from the wild type that is in circulation. Unfortunately, I don't think we're doing as much sequencing in the US as we ought to. We are currently, depending on the state that you're in, the number or percentage of isolates that are being sequenced is between 0.5 to 5% of the isolates. When you compare this to some European countries, they're sequencing over 50% of their isolates. I believe Germany is close to 90%. It's important to determine the impact of these mutant strains in vaccine breakthrough infections, because this will happen. I think we have already identified a couple cases of this. So whenever this occurs in someone who is fully vaccinated and becomes symptomatic and tests positive for COVID-19, that isolate is sent to the CDC for sequencing. And also, I think it's important because I deal with outbreaks every single day, that whenever an outbreak is identified, I try to flag those isolates to have them sequenced to see whether or not the outbreak is attributed to the wild type or to a new variant strain. Here's a map that shows you the number of reported cases in the US, and this was last updated February 9th. This I copied directly from the CDC website. So you can see the B117 is the predominant strain. We've had over 900 cases reported in 34 states, and Illinois is one of those. The B1-351, or the South African strain, only 9 cases have been reported from 3 states, and then the P1, the Brazilian strain, 3 cases have been reported from 2 states. As of today, Illinois has reported or identified 22 cases of B117, and as Dr. Werner, who's on top of his game, informed us, the first case of B1-351, the South African strain, was identified and reported in Illinois today, just shortly before 4 p.m. today. So what are we doing to address this in Illinois? As I said, we're not doing sufficient sequencing, but we are positioning ourselves. The state is, in fact, ramping up their ability to do more sequencing. So Southern Illinois University School of Medicine has been partnering with IDPH on sequencing for several months now. IDPH sends, like I said, all of the suspicious gene types to a CDC to have them sequenced. Independent laboratories like LabCorp, Mayo, and Helix are contracted with the CDC to do sequencing studies. The Chicago Department of Public Health has a partnership with Rush University Medical Center to do sequencing. The IDPH Chicago and Springfield labs will begin sequencing very soon, and I can't wait for that to happen. One of the things that I want to point out is the last bullet point here is that we're doing something rather innovative. UIC and University of Illinois, Urbana-Champaign, are testing wastewater. And this is a very interesting surveillance study that they're engaged in, because the COVID-19 virus is shed in stool, so you can find it in feces, and what they're doing is testing wastewater, and it's a very interesting way of determining the community prevalence of COVID-19. By doing, instead of testing individuals, you can test the wastewater in certain regions, and you can determine, the prevalence of COVID-19 in that region. I think that's the end of my slides, so I will stop sharing now, and I'm happy to take any questions you may have.
Thank you. That was very informative and literally up to the date in the last couple of hours. So thank you very much. I think we need to keep in mind, although we're beginning to see numbers going down with community infection and people are getting vaccinated, we can't let our guard down, though. You know, as this virus is circulating, the more it circulates, the more mutations are going to occur. Is that correct, Mike?
That is absolutely true. The more it mutates, and I think anyone who has watched Dr. Fauci on TV recently, he says this repeatedly, and I'm glad that he does, that replication leads to mutations. So our goal is to stop this virus from replicating, and the things that we have to control that or prevent it are only two. We've got it's a two-pronged approach that we're taking. So we have these infection control precautions that we insist that people follow every day, which is the masking, the distancing, avoiding crowds and gatherings, cleaning your hands, cleaning the environment. And then also, now that we have the vaccine, that's the other tool that we have to use. So we have to ramp up the vaccination rates, and we have to adhere to those infection control precautions.
The other prediction that I've heard is that with these variants, we may expect that some form of COVID is going to be in the community for a while. Whether it's going to become like flu or it's going to mutate each year, we have to have a booster, or it's just going to be circulating. We don't know yet, but it is a cautionary tale.
COVID is here to stay. It will never go away. It will be just like we manage any other vaccine-preventable disease, like measles, mumps, rubella, chickenpox, all the others you can name. So is COVID. We don't know whether or not, how we're going to manage this in the future, whether it's going to be one vaccine, administering the 2 doses of the 2-dose vaccine, which will provide us with long-lasting immunity. That's yet to be determined, or whether or not we're going to manage just like influenza, whereby we have to vaccinate every year.
Other questions or comments?
Dr. Lin?
Thank you, Dr. Vernon. I just finished, prior to entering this Zoom session, an educational program through the Medical Society where we went over this. And one of the things they wanted to emphasize is, that people are getting panicked because now they're reporting, oh, it's in Illinois. Well, I think most people feel that it's been in Illinois for a while.
Yes.
It's been throughout the United States, these variants, just we haven't looked for them. Mm-hmm. And the good news is that virtually all of and remember, there are multiple mutations for each variant. So there's variations of the variants. And just like there's this new California variant they're talking about. But for virtually all of them that have been looked at, except for the 351, the existing vaccines appear to have a good coverage from an antibody response. The 351, which is, I don't like using the location country nomenclature because it's misleading.
Yes.
But even with the 351, with like the Moderna vaccine, there's a 10-fold less coverage, but it's still at 70% in terms of avoiding, significant clinical disease, which is still really great.
Correct.
So our concern is not what's currently not existing. It's, as pointed out, until we can get on top of this infection, get more people vaccinated, you're going to have this constant churning, and people, as you pointed out, Bill, are going to be producing virions. And every time they produce a virion, there's a potential for mutation. And some are going to be advantageous, and those are the ones that are going to persist and give us more difficulty. So it's really, the approach that we have to rely on. And the other thing I just want to emphasize, and this is not necessarily for this group, I think you know this, but when you talk to people in the community, just because they're getting vaccinated doesn't mean that they stop being careful. And, the other sound public health approach with masking, washing, and distancing is still critically important because people will still become infected even though they've been vaccinated, they just won't become sick. And they will then be at risk to transmit it to other people potentially who aren't infected, who may be more vulnerable. And I know that I'm already hearing people talking about having vaccination parties. You know, now the group of vaccinated people want to get together and, you know, throw caution to the wind, and I think that's premature in a sense.
Not recommended.
Right.
My screen just disappeared. Does that happen?
No, yeah, and you look very good. I see you fine, loud and clear.
Okay, I'm flying blind right now, so is any other discussion about this? Again, we owe a real debt of gratitude to Dr. Vernon for giving us this update. The other bit of business, this is old business, and that is the update on e-cigarette sales ordinance, banning the sale of flavored e-cigarette products. I think, Mike, you were going to give us an update on that?
Yeah, I do, and I want to first thank Dr. Vernon. When I hear people present things like that, I realize there's people smarter than me in this world. So I appreciate the fact that Dr. Vernon is part of this board. So I have submitted a memo to the village manager that supports and reiterates the Board of Health's recommendation that the village board amend the village's tobacco ordinance to prohibit the sale of flavored e-cigarette products. And I just wanted to provide an update that as soon as I find out more information about the next steps, I will provide that information to the Board of Health. And that's the update.
Okay. Any discussion about that? My screen is back, so thank you. There's something in the chat box. Let me see. This is from Heidi. Dr. Vernon, that was fantastic. Thank you. And also to everyone, thank you from Mike. Thank you for the kind comments. All right. Well, we're at the end of the agenda. Is there any other new or old business? Are there any?
I just wanted to thank everyone for the feedback. I think it's helpful to have the feedback of the board. I think that we tend to sometimes live in our silo in the basement here, and I think that getting the feedback is really helpful, so I appreciate all the helpful feedback tonight, guys.
And are there any citizen comments?
There are none.
All right. Well, we are then at the end of the agenda, and unless there's some objection, we will be adjourned. So thank you. And Mike, Charlie, thank you for, I think you've been standing for over an hour, so you've earned your pay tonight.
Okay.
All right. Well, our next meeting then is March the 11th, and we'll see you then.
Okay, thanks, guys.
Bye-bye.
Have a great night.
Meeting, thank you.
Stay healthy.